Hello, my name is Monica Martin, and I am going to be reviewing evidence-based implemented proposals. What I wanted to talk about is what is an evidence-based implemented proposal? This is a proposal that's created to answer any questions or to solve a problem using evidence-based literature. Reasons. These proposals are used to gain and develop new knowledge through the research that we have. The use of the most recent evidence-based practices to improve clinical patient outcomes. That's pretty much why we use an evidence-based proposal. So the way that we use the evidence-based proposal is we will go through and use the PCOAT or the PCOT method. This is basically a way in which we create a clinical question to be answered. It's a systematic method assisting in the creation of the clinical question. It helps formulate the question. The components of the PCOT method are the person or the patient or population. We talk about the intervention, the comparison, and the outcomes within a question. So those four components are put into a question to ask a proper systematic question that talks about evidence-based implementation proposals or a concern or a problem that you want to try to address based on information that you find in clinical research. So the situation. So recently in my healthcare facility, there's been an increase of customer service complaints. There's also been an increase in falls with or without major injury. There's been some medication error reports. And there's also been a decrease in customer service outcomes on some of our surveys that we have sent out to families and patients when they come into our facility. So we've identified that there has actually been, or there actually is rather, a problem in my workplace. That of a skilled nursing facility. It's a 160 bed facility. We have 239 employees, which is quite a bit in employees. It is a 42 bed rehabilitation unit. It has 2 full-time APRNs on the rehab unit. I have my own rehab medical director, and we are a hospital preferred provider. So some, I will not mention their names, but some of the hospitals in our area, we are preferred providers for them. So we have to live up to the hospital expectations and do the training that is required of the hospital. So the target population that I'm discussing in my evidence-based implementation proposal is the post-acute care resident within my skilled nursing facility, along with their family members, caregivers, and the community that they were admitted from. My population is also the skilled clinical and non-clinical healthcare providers, which is pretty much everybody. So the question that I formulated, or the PCOT question asked, is, will educational sessions related to individualized customer service result in participants stating that they are aware of strategies to improve customer service for post-acute care residents within a skilled nursing facility? Outcomes of the things that have happened. So the literature, what ended up happening is to come up with this question, we reviewed certain literature and we went through the documentation and the research, and we reviewed 5 articles. The first article was Access, Welcoming, and Family Health Strategies, User Satisfaction, the Research Performed. It was a quantitative, transversal, descriptive, and exploratory study. And this review was done for the purpose of the study, or the purpose of the study was to analyze the level of satisfaction the users had in connection to the access to the primary care system in an area population. So how satisfied were they in the area regarding the access they had to healthcare? So they're not from the United States, and they were more satisfied in an area where they had more options to better customer service. In the second article, in the second literature review, I reviewed an article called Hospital Discharge and Selecting a Skilled Nursing Facility. This was a qualitative comparison study. The purpose of the study is to examine the role in the decision-making of a patient versus a family member in the discharge placement process of an individual into a skilled nursing facility after completing a hospital stay. And what was interesting about this study is that it discussed how family members and the patients didn't have the same input in the locations and where a patient would stay after they've been discharged from the hospital. So family members were more the ones that chose the option of which long-term care facility or rehab facility they would stay in. After giving them technology at the bedside and allowing them to see the different types of skilled nursing facilities that they have in the area, it was determined that it really didn't make that much of a difference because of their comorbidities and their health current situations. Families do make a big, they have a big factor, play a big factor in the locations in which a patient is sent to, which kind of impacts my evidence-based implementation proposal because of customer service. It's sometimes difficult to have positive patient outcomes when they didn't want to come to the skilled nursing facility that was chosen for them in the first place. So that leads me to believe that some of this quality assurance and information that's coming in from CMS and Center of Medicare and Medicaid and making sure that the quality of your patient care delivered is of exceptional levels, it can be impacted just by the patient's preference and choices in the location in which they are staying. So obviously when we're sick and we go into a hospital, we do not make the same decisions as we do coming out of the hospital. So obviously those Press-Ganey survey results are going to be different based on how healthy we are, I guess you'd say, versus how sick we are when we come into the place that we're at. So that was very interesting in this literature review. So the next article that we're going to talk about is patient-centered care as a way of doing things, how healthcare employees conceptualize patient-centered care. So this article also has a big impact on how, in fact, we visualize or how we see patient-centered care as an employee. This is a big thing with customer service and the evidence-based implementation proposal because it's also our interpretation of how the customer service that we give is provided. It was a qualitative research, and the purpose of the study was to examine how employees understand the concept of patient-centered care that they are utilizing in a healthcare setting. And it found that at higher levels of management, they understood patient-centered care a lot more than the frontline staff. That also has to do with customer service. I think a lot of managers understand the importance of customer service and what it is and how it impacts patients and patient-centered care outcomes. However, the employees don't see it as the managers do. So it was definitely a good article to review, and it definitely gave me some ideas on how it can also impact my proposal. The next literature review was implementation of person-centered medical care model in a skilled nursing facility, a pilot evaluation. This was a mixed method, qualitative and quantitative research. The purpose of this study is to examine how implemented person-centered care model would impact post-acute care residents in the skilled nursing facility. So you're discussing how person-centered care impacts the patient in skilled nursing facility, and it does. It has a lot to do with customer service, and it has to do with making them achieve and have the type of care that they expect based on their wants and their needs, and that again ties into customer service. It's all about the individual's idea of what customer service should be and how it impacts them individually. The next literature review was the consequences for poor communication during transcription from hospital to skilled nursing facility. And this article was a qualitative study. The purpose of the study was to analyze how these 5 skilled nursing facilities overcome barriers and transition patients from hospital to skilled nursing facilities. So this was huge in how it impacted my evidence-based implementation proposal. Poor communication during the transfer from a hospital to a SNF has a major impact on a patient. It impacts their customer service. It impacts their medications. It can impact a lot of what needs to be done. There's times when you go from one setting to another and you're missing so much information, it makes the patient feel uncomfortable. There's a delay in care, there's a delay in treatment, there's chance for medication errors, and it goes on and on and on. And that is what based my evidence-based implementation proposal also, is that it's the poor communication that we receive and how it also impacts all of the patient-centered outcomes. So it was definitely, the purpose of this study definitely helped me gain a better insight in how important proper communication is with the patient during especially the beginning type of transfer from the hospital to the skilled nursing facility. So the nursing theory applied, I definitely could see my PCOT question demonstrating that an individual needs were concerned when demonstrating Margaret Newman's theory of health expanding consciousness that would be applied even in my long-term care setting. A patient's awareness of the environment assists in finding meaning and understanding within his current health situation. So if you have a patient who feels though they're being cared for and they feel like they're receiving the service that they are there for, they're going to have a greater outcome. So I definitely feel that I could use her theory and apply it to the situation in my evidence-based implementation proposal. So the situation overview, based on the situation in my facility and my problem, and based on the articles reviewed, and based on data that I collected. So that would be my Press-Ganey scores, my complaints, my ANI logs of my increases of falls, and based on the PICO question could then be asked, but it needed to be approved. So we came up with the PCOT question of if we increase the education to our population and to our employees, will it impact customer service? But I needed to get the buy-in from my customer service committee. So we had an institutional review board. It's different than it would be in a hospital. So the first step would be to go to my director of nurses, who is my department head. Then I would go to her supervisor, which is the administrator. If she felt that we needed some legal advice, she would go to the attorney if need be. Then as soon as the attorney approved it, it would go to the customer service committee and we would discuss it as a committee, which we did. And then we went to the quality assurance performance improvement committee, who works on all the quality issues and measures that are in our facility. And then after that, I went to medical staff, where the medical director of the facility approved us working on the customer service question and approving the evidence-based implementation proposal in my skilled nursing facility. So we reviewed the educational sessions in a team through the customer service committee. New educational sessions related to individual customer service will result in participants being able to be more aware of customer service strategies that improve overall customer service. We discussed starting a new welcome booklet. This welcome booklet or resident orientation would review with the patients all the different components of our facility. We discussed what we were going to do and when we were going to do this. And after this has been reviewed with the resident, what those impacts would have on the staff. So what we came up with is a checklist that we would use to make sure that these educational bits of information for the resident get to the resident, and that we would check off and make sure that information would go over to the patient, and this documentation would remain in the chart in the educational section for the patient. We wanted to know that these educational sessions focusing on patient-centered care and customer service strategies would have an impact on patient-centered care outcomes. We wanted to see some increased patient safety. We want to see a decrease in the medication errors. And overall, we want to see increased patient satisfaction scores on our Press-Ganey survey results. So because educational sessions would be different for different levels of people, we did one-to-one education related to customer service for all staff. So what is expected from the supervisor to review with the patient is not the same as it would be for the certified nursing assistant. So the certified nursing assistant would have a different type of education that would need to be provided to them, things to understand and look for to discuss with the patient, and ways to handle certain situations. The training on the welcome booklet, we wanted to make sure that got instituted in our facility. Checklist, we wanted to make sure that that could be reviewed with the nursing supervisors and department heads so they knew what they were, what they did, and who was responsible for which sections of the book and who was to follow up to make sure that these sections were completed. We did employee training with the rehab employees first and only. We are going to center it to the rehabilitation units first before rolling it out to the rest of the facility. And then we also did customer service competencies annually, new hire orientation, customer service training, and ongoing monthly training with pre and post tests to make sure that as we continue on with customer service training, the basics that they learned from the month prior, that they would have a knowledge base of it, and that they would be able to build upon that. So disseminating the evidence, educational sessions were mapped out by department, unit, and shift. We scheduled events, lists of dates and times on the director of education bulletin boards and lunchrooms, on informational boards by the time clocks. We also attached all this information to the employee's paycheck to inform them ahead of time. Educational sessions were incorporated into the organization and annual competency training and monthly staff meetings. This is an ongoing 6-month process, so each section will be handled in a monthly component, and it will be built upon as we need to, when we can go back and forth as we need to make things better or change things. But we spent a lot of time reviewing the information prior to beginning so that we don't have to work backwards. We can add to it as we need to going forward. So we review the data after we are done with our education and we give it all to the employees and the supervisors and the department heads. We want to go back and we want to check the Press-Ganey survey results. We want to monitor the quality measure data reports to see if our quality measures went up. We want to see our accident and incident reports with or without major injuries, falls, or medication errors decrease. We want to see the pre and post test competencies and see if in fact there is made a difference from this education. So let's just do a little recap of my evidence-based implementation proposal. We found out that customer service was poor, patients' Press-Ganey scores were low, we had high falls, customer service was an issue. So I came up with the PCOT question: will increased education impact patient-centered care outcomes, and will it impact scores? I went through and reviewed some literature and research and reviewed it. Evidence was then implemented through educational sessions with approval, of course. Outcomes were reviewed and analyzed, and we continue to reanalyze and make sure that these educational sessions do not just go into the sea of information that the employees get. And we will continue to review and see the different scores and surveys as we move on with this project. And these are my references, and I thank you very much for listening to my evidence-based implementation proposal project, and I look forward to any feedback that you have. Thank you.